There we go. Hey, everybody, and welcome to UpRise Live, another edition of UpRise Live. It's Thursday, it's 3-ish, and of course, we're here. I'm Al, and I'm so excited for you all to meet one of our fantastic community and employer partners here. Lindsay Miller is here with us, everybody. And so now, I will say, if you're in Uprise, you know how important and how bells started popping off and explosions started happening when I said Lindsay Miller, like, bah, 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 bah. Courtney and Edit, and everybody knows Courtney is our executive producer. So in Edit, Courtney, I want you to put explosions and things behind when I say Lindsay Miller's name. So right here, Courtney, put explosions. Thank you, everybody. But y'all, thank you for being here with us. And thank you, Lindsay, for joining us today. Y'all, I think we have somebody with a ton of information for you to know about the medical field. But first, Lindsay, welcome. Thank you for being here.
Thank you so much. I'm glad to be here. Gives me someone else to talk to today on my Zoom computer, so it's great.
And so, look, y'all, you see the blurred background. That is when you know somebody's working hard in the office and they're like, blur the background so I can knock this out and get back to work and get back to it. But you all, Lindsay, tell us what you do and how do you help the world?
Yeah, so I started off as a nurse and an RN. That was about 16 years ago. I became a nurse. I graduated from Belmont University here in Nashville. And then I was a nurse for a little bit, and then I became a nursing leader where I started managing nurses and units. And then I became a director, and now I serve as one of the associate nursing officers at Vanderbilt for their Adult Ambulatory Enterprise, which really just means their clinics, is one of the areas that I'm over. And so some of the things that I do is, well, I do a lot of things, but I help run the clinics and oversee the clinical operations from the front desk to the nurses to, how can we help the doctors? How can we get the patients in to be seen? So kind of all of that, the operations piece of that for different service lines here in our outpatient world.
Fantastic. And so again, y'all, you have to know what this, if I see already somebody in our comments, one of our leaders who is just hands in the air for Lindsay, who has helped us with so many opportunities. And we'll talk about that in a minute. In fact, let's move into that. Tell me, so how did you connect with UpRise? How did you get connected with UpRise Nashville? I know how I would say it, but how would you say you got connected with UpRise Nashville?
Well, I didn't know that it existed, first of all. And then we had this wonderful employee come to one of our clinics. And it wasn't until later that I heard her story. And it completely just shook me, her story, because her story was like a lot of people's, right? And she was having some hard times and, connected with UpRise, who helped her get the education that she needed. And then we were able to hire her here at Vanderbilt. And she is still one of our most amazing medical assistants. I actually see her name in the comment chat right now. So she makes me a little nervous.
Yeah, not pointing anybody out or anything.
Yeah,
right?
Look at that. I see her right there. But and she's going to be one of our first medical assistants to advance in our medical assistant ladder, right? She is a phenomenal medical assistant. And, her story really just spoke to me that, wow, there are so many people out there that want to help people, that want to get into the medical industry. This is a good, stable place to work. You can grow, you can learn, you can climb the ladder. And so I wanted to get involved with the organization so that I could help other people do that.
And you guys, we have been blessed enough to have Lindsay come in and be part of camp, be part of some other, and help leaders in terms of navigating the waters when you're trying to to move into the medical field. I agree with you in the comments, Jessica. I agree with what you just said in those comments there. But y'all, I think what was also so amazing was that Lindsay was able to come and join us for camp. And everybody knows that camp is the first step for you to move with UpRise Nashville. and give leaders some insight before they're even getting started. So she's giving insight and she's talking to leaders and talking to our classes about things they need to know about the industry before they even get in, which has been amazing on our part. And so, what I want actually, if Lindsay has a moment to share, is to tell everybody that what positions are out there in the healthcare field. I mean, I've heard, they're nurses, and then there are the people who are not nurses, and then they're doctors, and I'm assuming, and then
there's a lot. Well, there's a lot, and there's a lot of work to be done that people don't know about, right? And so I work with the people at UpRise all the time to say, gosh, there is somewhere for so many people, right, here at Vanderbilt. And so, and at other healthcare organizations, right? And so some of the types of positions that we have available are like front desk positions where people can greet patients, check them into a clinic, verify their insurance, all of that type of stuff. We have people who help schedule people. We have a whole department that works from home called our Care Connections, where they answer our phones and get people appointments that they need. And they all work from home, and those individuals, they need to have good customer service skills and they need to be able to, utilize the computer. But those people have fabulous jobs, right? We also have those that require medical training. So medical assistants that need a certified medical assistant. That's what we see a lot in our clinics. That's what the person that I've been speaking about is a medical assistant, right? And we need so many of them. If you are a medical assistant and you need a job, we will find you one. I promise you that, right? We need you so bad. But we also need all of the other people. So, I spoke with Carol at UpRise, and, a lot of people at UpRise get computer training. Well, guess what? If you get trained in Microsoft Word and Excel and you learn how to be really good at using the computers, you are a perfect fit for some of our like front desk, surgery schedulers, insurance people. I mean, all of that type of stuff we train you to do here. And so there's just all kinds of opportunities at Vanderbilt where we can plug in.
And I think, and of course, as you said when you were talking about your ladder, can you speak about how somebody's able to move at Vanderbilt? I was going to say at UpRise, at Vanderbilt, because I think for a lot of folks they'll be like, well, if I get there, is this it? What do I do next? And so, could you talk about what it would look like how do people move in the company if that's possible?
Totally. So I have managers right now, or managers that I know of who started as front desk supervisors or front desk people that started checking people in. That was their first job. And then they moved and they progressed and they demonstrated their skills and became a lead and then became a supervisor. Now they're a manager. One of the managers that I can think of that works with me, she's getting her master's in business right now. She started as a front desk person, right? And so that's some of the career progression for the non-clinical people. For our clinical people, medical assistants, we have tuition reimbursement. We will help you get your nursing degree. We will help you, all of those things. We will help progress people along. So all you have to do is be interested. We also have in our medical assistant and LPN and other degrees, we have an advancement ladder, where if you meet certain criteria and do certain things, you can get paid more just for doing those things. So the individual that I was talking to you about, she has gotten some additional education, so done some additional modules. She volunteers with UpRise, right? So that counts as part of her check mark, right? And then she also participates in her area's peer interviewing process. And by doing all of those things, she's going to be able to apply and become a medical assistant too and get paid an additional X an hour, right? And then she could progress and do more things next year and become a medical assistant 3. And all of those things significantly can improve the amount of money you make, and you don't even have to go back to school, right? So those are some of the things that you can do just within your role.
So, and I'm excited because often there are a lot of people who want to go into the medical field, and there are opportunities. I'm glad to hear and you say, somebody who is actually influencing hiring, that there are opportunities out there that are not just the one shop stop. If you have the desire,
Mhm.
you could look at working and making a difference in the medical field. And
Absolutely.
so I think that's amazing. Again, before I ask you this last question, because I started looking at the time and I'm seeing the red light blink from I have, just because of my contract to be on this show, I have to say that my executive producer is Courtney a certain number of times, or else I get dinged, right? So I'm getting the red light from my executive producer that, hey, uh, Lindsay's schedule is full and I need to hustle up. But could you tell, if you were to give some advice to someone, a Nashvilleian, a person who's looking right now, they're sitting at home and they're thinking, should I take the chance at trying to do something medical in the medical field? Should I do the training? Should I invest in myself? What would you tell them?
Well, I would say absolutely do it. Here's the thing about the medical field. It's not going anywhere. It's a stable employer, right? People are always going to need us at the hospital and in medical centers. And so investing your time in a career that is going to be there in the future, that is, that's invaluable. You can totally do that. And you can find different things that interest you, right? So, within the hospital or within our clinics, if you are really passionate about women's health, or if you're really passionate about the LGBTQ community, we will plug you into those people, right? We will plug you in to help. You can find places to serve that really, fill your bucket, right? That help you serve the people that you want to serve, right? Or if you want to work in the cardiac clinic or whatever, right? Like we have
Mhm.
places. So, think about what you're interested in, or think about the patients that you're passionate about. And then we can plug you into those areas, because I think where people work that they're really passionate about those places and they really care about those populations, they shine even brighter, right? So, we have so many staff who say, I want to work in cancer because my parent had cancer, and, I want to make a difference with that population. We will help you get there, right? And so that is just, that's what I would say is, the medical field is great. There are so many places. And if you get one place and you get bored with it, guess what? There's 75 other places that you can go that, and you'll find something different and interesting there. Mm-hmm.
No, that is fantastic. Again, I want to say your name so Courtney will know to throw the explosions in. So, y'all, we are excited to have Lindsay Miller explosions right here. Courtney, make sure you input those in, not just in the chat. I see in the chat that somebody's writing explosions every time. But, you all, we are so blessed to have a partnership and work with somebody like Lindsay, who is truly just making modern day miracles, helping our leaders get into these positions that are changing folks' lives. And so, you
It's
all,
my pleasure. I'm so glad that I get to meet all of you and that I get to do that and I get to help with that, because it's important. It's so important. And what I've seen this organization do with so many of the leaders that have graduated from it, it is truly, it's amazing, and it's so worth it.
well, y'all, if you are interested in Uprise Nashville, we are in the last 3 to 4 weeks before our next training camp. So click the link that you see around here, or go to our website, upside. Oh, that's not going to sound right.
UpRise.
Uprise Nashville, uprisenashville.org. Go to that website, click, sign up for an info session, and really bet on yourself in 2020, my friends. Get trained, make yourself available to have an opportunity like presenting yourself in front of somebody like Lindsay Miller, and who can help you walk into opportunities if you're willing to put yourself in position. So we're recruiting for the next class. We're starting in February. We're so excited for what this year will bring. We're so thankful again to work. Put it in the comments, the explosions, Courtney, with Lindsay one more time, y'all. Thank you for joining us today. Thank you for being on, everybody. And we will see you all next time. Have a great day, y'all. Have a good
Bye
one.
bye. See ya.